Hello, everyone. Welcome to the third series in the HRA Capacity Building Sessions.
Muy bien, empezaremos nuestro programa. Buenas tardes y bienvenidos a todos a nuestra tercera sesión del desarrollo de capacidades de evaluación de riesgo para la salud.
We're certainly glad you can make this. The goal of this meeting is basically to hear more about your concerns regarding how health risk assessments are currently being conducted and how they're used to make decisions by regulators.
Nos complace mucho tener este programa. Básicamente lo tenemos para escuchar de vuestra parte sus preocupaciones, su pensar sobre cómo se desempeñan las evaluaciones de riesgo y el efecto que tienen ustedes y en su profesión.
In this meeting, we'll be hearing about not only how health risk assessments are currently being done, but also hear your ideas about new tools or new different approaches we can take to better health risk assessment.
Y en esta junta hablaremos no solamente cómo se están desempeñando ahora las evaluaciones de riesgo, pero nuevas herramientas, tal vez nuevas sugerencias de qué piensan ustedes, cómo se podrán hacer en el futuro de una manera para mejorar el proceso.
So we look forward to hearing your comments. And at this time, I would like to turn it over to Amanda, who has some housekeeping items that she would like to go over.
Así que aguardamos muchísimo escuchar vuestros comentarios, pero primero queremos darle atención a Amanda, que nos dará unos recordatorios para hoy.
Thanks, Robert. So to get started, just as a heads up, we are recording this meeting, so that will be posted to CARB's YouTube channel sometime next week.
Muy bien, gracias Robert. Entonces primero, para dejarles saber, esta junta se está grabando, así que se postará en el sitio web de la CARB en algún momento la semana que viene.
And then Mark is going to help us with some instructions on how to access interpretation during today's meeting.
Y ahora proveeremos algunas instrucciones sobre cómo acceder a la interpretación en español para la junta el día de hoy. Para aquellos que deseen escuchar el programa, hay interpretación al vivo. Lo que tendrán que hacer es buscar en la parte inferior de vuestra pantalla un icono con un globo que dice Interpretation o interpretación. De ahí seleccione su idioma, el español, y tiene la opción de silenciar el audio original o Mute Original Audio. Así podrá escuchar solamente al intérprete durante el programa. Y para aquellos que no tienen acceso al Zoom, pueden hacer por teléfono, llamar y podrán escuchar el programa de nuevo al vivo en español por marcar este número: 1-866-803-2146. Una vez más, el número es el 866-803-2146 y tendrán que ingresar el código 1083550 para poder escuchar la presentación en español. Muchísimas gracias y si tienen alguna pregunta, por favor, déjenos saber. Back to you, Amanda.
Thank you. Are there any questions about how to access Spanish interpretation?
¿Alguna pregunta sobre cómo acceder al canal en español?
Okay. So I don't see anything in the chat or any hands up. And then as there may be questions in Spanish, we do encourage monolingual English speakers to select the English channel. And you'll see that with the interpretation icon at the bottom of your screen.
Y claro, si es que surgiera un comentario, una pregunta en español, aquellos que quieren escuchar en inglés pueden hacer lo mismo y tocar la función de interpretación y simplemente seleccionar inglés en la parte inferior de la pantalla. Thank you, Amanda.
Thanks, Mark. I'm going to go ahead and move you over into the Spanish now. Thank you. Okay, so we just have a few housekeeping items. If you've been to these meetings before, you've heard me go through these, so I apologize. But before we get started, if you can just make sure that you're muted if you're not speaking so we can limit interruptions. We also would really appreciate if you are affiliated with a specific group to include that in your name. especially CARB staff, if you can make sure that you put CARB in your name. And the way to do that is in the top right-hand corner of your picture, there's 3 dots. You click that and then you select rename. And additionally, we do have closed caption available today. So at the bottom of your screen, you'll see CC live transcript. And once you click on that, you can choose to show the subtitle. And then muting and unmuting, we'll be asking you to raise your hand if you'd like to provide a verbal comment. So once you do that, Chelsea will prompt you to unmute and you'll see a message that the host would like you to unmute. Please select OK. And then if you're calling in today, you'll be dialing *6 to mute and unmute. And that microphone is typically at the bottom left or the top right of your screen. And for video, it should be right next to your microphone icon. We do encourage you to use your camera if you're comfortable today. We'd love to see you, but of course, that's just based on your comfort. And that icon's usually in the bottom left or top right-hand corner of your screen as well. And then in order to raise your hand, there's potentially 2 places, just depending on your version of Zoom. So it'll either be in your participant list. You'll see the raise hand icon at the bottom of that list, or under reactions. If you have a reactions icon, raise hand will be one of the options there. If you're calling in today, the option to raise your hand is *9. Unfortunately, that doesn't always work. So throughout the session, Chelsea will be checking in to see if there's any comments from the phone lines today. So if there is, once she prompts that, please just go ahead and unmute yourself and start talking in case we don't see your raised hand. And again, to unmute, it's *6 over the phone. We'll also be using the chat today. The chat icon should be at the bottom of your screen as well. You can send private chats to any of the co-hosts, and you can also send chats so that everyone in the meeting will be able to see them. I just want to remind everybody that those chats are not private. They will be saved to the Zoom record. So please keep that in mind if you are sending a private chat today. And then lastly, we're going to use a new software today. It's called Padlet to collect some of your input, your comments, and your questions. So I'm going to put the information for that and how to access it into the chat. And if you want to go ahead and test that link and let me know if you have any issues with it, in order to add a comment or a question into Padlet, it looks like little sticky notes, and there's a plus icon in the bottom right-hand corner of your screen. You can select that, or you can double click anywhere on the screen as well. You can also upvote and comment on posts that have been provided by other people. So let me stop sharing my screen and I'll just show everyone how that works real quick here. And like I said, if you are having any trouble with it, please just let us know. And I can either message you privately or raise your hand and we can verbally try to explain. So this is what it should look like once you select that link. And then in that bottom right-hand corner, there's a little plus sign, turns into a pencil. If you click on that, the subject line will be these like darker, larger ones. And then you can put your comment here and then select publish. Once it's on there, you can move it anywhere on the screen. You can also just click twice and you'll get that same option again. Is anybody having trouble accessing that link? I'll stop sharing so I can see. Okay, yeah, and just raise your hand or put it in the chat if you are having trouble. Matt will revisit and talk a little bit more about our goal for using Padlet today and what we'd like to include. But if you're unable to access the link for whatever reason, please just verbally give your comment and let us know that you want it added, and we'll make sure that we put your comment into Padlet to record it. So I'll turn it over to you, Matt. Thanks.
Okay, I'm going to share my screen again. Just a second. Okay, so I want to introduce myself. My name is Matthew O'Donnell. I think many of you already know me, but just in case you haven't, it's very nice to meet you all. I'm glad you're here and able to join us. I'll be functioning as the facilitator today. There really isn't much of a presentation per se. Today, this is an open discussion. I'm really just here to be part of that conversation. Amanda's already introduced herself, but Amanda's been doing a great job of facilitating that. She'll be helping out today with Padlet and with making sure that we have all the comments that are important that everybody wants to have in Padlet recorded there. I'd also like to make you aware of the fact that we're going to have some representatives from the Office of Environmental Health Hazard Assessment, or OEHA, with us today. John Boudreau, and I apologize, Lily, but I didn't have Lily's name on here, but Lily Wu from OEHA will also be joining us today, and they'll be addressing questions or comments that are specific to OEHA's role. So just a quick background and reminder in case you weren't involved in the first two sessions. As part of the discussion and presentation that we had previously in the previous two sessions, there were quite a few comments about the nature of the way we approach health risk assessment currently, and some concerns about deficiencies in that approach, and comments about how it could be improved. So the whole point of today's session is actually to discuss that, to address those concerns and to gather as much information from all of you as we can. That information is important to us, so we want to make sure that we have a record of that, which is why we're using Padlet. I'll get back to that in a second. So the point of today is to provide an open forum for that discussion. That being said, I don't want to stifle any conversation either. So if you have concerns or thoughts you'd like to share, or even questions that may not be directly related to changes to health risk assessment, or even health risk assessment specifically, but you think are relevant to the discussion, please feel free to speak up and share those thoughts or ask those questions. We will do our best to answer those things that we can today, if there are questions, but there are likely going to be quite a few things that we won't be able to give you answers to today. So the whole point then of using Padlet is to gather that information together. So what we would like to do, whether it's a verbal comment or a comment in the chat, we'd like to have either you compose it directly, or we may just sort of summarize your comments, your verbal comments, and put those into Padlet. And my thinking here for wanting to use this is so that we can have those comments on the screen. Everybody can see them. Those will be food for thought and seeds for additional discussion. But also it'll give us the opportunity to sort of gather those things together into major categories. And the reason I want to do that is because we're probably going to have to come back and discuss this in further detail later. Some of those topics are going to need further discussion. So we want to make sure that we can gather that all together into categories and prepare ourselves for future discussions. And the other thing that we want to be able to talk about today too is options for additional HRA tools. So if you have thoughts about the way that we can approach HRAs that go above and beyond what we are currently doing, or changes to the existing tool, then we want to talk about those as well. Okay, so please feel free to talk about whatever you want to talk about, express concerns, ask questions. I know the way these things typically work, people are kind of reticent to do that, and then someone starts and then everybody gets comfortable. So be that brave soul who makes the first comment or asks the first question, please. Just a little bit of framing so that we, this is probably something that we were going to have to say anyway, so I thought I'd say it up front. There are going to be things that are going to be asked for, likely, that are going to be outside of our authority, that CARB won't have the authority to change. So I just want to kind of give everybody a brief understanding, or of what we have control over, what we has control over, the district, so on and so forth. So in terms of this topic, we have the ability to come up with our own policies and procedures for cumulative impacts analysis, which I'm sure is something that's going to come up today. However, that would be for our internal use only. We also have some authority, at least, to talk about changes to the HRA methodology, but really that would only be additions to what we currently use. It wouldn't be changing that methodology. Ariana, I'll get to you in just a second, if that's all right. Unless, well, go ahead and ask your question, actually, Ariana. So you have your hand raised.
Mute.
There.
Okay, now I'm unmuted.
Oh.
So, actually, it's fantastic for me that you're actually discussing this openly, because it is an issue.
Mm-hmm.
And I say that because, for those that don't know, my name is Erin Harrison. I'm the founder of Marie Harrison Community Foundation, Inc. And we operate out of Bayview Hunters Point, which has also been a very long time resident. Matter of fact, some people might even say I never left the community because I work in the community as well. So the concern that I have in your measuring tool is that usually what I find is we have a license, we'll have some professional or so-called licensed professional that's engaging the community, but has never been to the community, or has never actually did any kind of physical testing on the human beings that actually live there. Seeing that I come from a community that is truly over industrialized, and also has radioactive markers and radioactive chemical waste there. To me, it is beyond me why it would not register that that there would be some kind of physical effect on people that stay injuncted to those areas. So I believe that that like the CDC has biomonitoring, right, and that kind of stuff. And for me, I think that if testing the people that actually stay in those areas, it would set a standard for how business is done and how operations are done in the community, how it's actually, how you guys are actually measuring hazard. Now, projectively, I feel, according to my talk screen, your analysis test, I know for a fact, and 4 other tests that I've taken, that I've been impacted in the worst kind of way. There's things in my body that don't belong in a human body in that magnitude. You understand what I'm saying? So for me, the measurement and how you measure hazard, what do you do that based off of? And is it reasonable to project that you guys would do that kind of testing within a community instead of coming after the fact, after the damage has already been done?
Right. Okay. So I want to capture everything that you're saying. So can you hang on to that? And I want to return to that here in just a minute. I want to get through this, and then I want to get to the point where we're showing Padlet so that we can get your comments recorded and we can have that discussion. So okay. Can I just, I really want to hear it, but can you give me just a couple seconds here?
Sure.
Okay, thank you, Ariane. Appreciate it. Okay, so just real quick, again, framing, there's going to be things that are outside of our authority, CARB's authority to do. So we can make changes internally to the way we approach things and also to the health risk assessment methodology, but not the methodology itself. We might be able to do something with socioeconomic impacts or some other framing, something similar to Kellen virus screen, or the exact kind of things that you were just talking about, Ariane, doing something to augment the current methodology. In order to change the methodology itself, that's actually in a WEHA's wheelhouse. They have the authority to do that. They are also working on cumulative impacts analysis. So that's kind of where their authority lies. Let's see here. Why am I not changing? There we go. For air districts, we several times in conversations, We've talked about, what will the air districts do with the information as far as permitting? Is there a limit that they can put on permitting that goes, that is triggered by the results of a health risk assessment? And that's really something that they have control over. They need to change, each individual district has to approach that and change their own rules or their own policies. So they have control over that, how to deal with the triggers, the trigger thresholds that are the result of health risk assessments, and those come under their 2588 authority, their AB 2588 authority. They will also, because everybody is looking at this, have to deal with cumulative impacts. My guess is that we're going to end up doing that sort of collectively. And by collectively, I mean CARB, OEHA, and the air districts represented by CAPCOA, the California Air Pollution Control Officers Association. If you're not familiar with who CAPCOA is, they are an organization that is a collection of all of the air districts in California, and their function is to help the districts work together with one another, and then also collectively represent the districts when they're talking either to CARB or to other groups. So they're also going to be looking at this. I'm quite sure of that. And they may also internally talk about cumulative impacts trigger thresholds. That is something that is on the minds of air districts. They need to come up with policies for how they're going to deal with the information they get once they start conducting cumulative impacts analyses. These are all things that we all need to be talking about together, but that's going to be within their authority and will likely happen through the auspices of CAPCOA. The last group I have on this slide is sort of the one that we have the least control over and the least influence with, and that is land use agencies. I know we've talked about this quite a bit in the previous two sessions, and there have been questions that have come up elsewhere about the notion of citing new facilities, new sources of pollution, new sources of toxins in communities that are already impacted. The districts have some control over it if the facility has to get a district air permit. But even then, there's a limit. And the only real influence that we have over land use decisions, either the ARB, the CARB, or air districts is through the CEQA process. And even then, it's through comments and recommendations. We have no direct authority really over asking them to do any one thing or another. So those are just ways of framing the conversation. I want to make you aware that there's going to be some limitations as to what we can commit to and where our authority lies.
So Matt,
Yeah.
really quickly. Okay, when you're making an emergency contingency plan, I know some people don't put it together for which should we be concerned about biomonitoring? Because okay, so let me tell you why. When radioactive dust or silica from our recycle companies become airborne, that is something called magnificating. That means it's going into our lungs, through our noses, and all that stuff. And then it is an air district. It's kind of on their level of feed. Sure. So it also impacts every organization that's put in place to protect our health and well-being across the board. And I think that all parties involved are losing a golden opportunity not to take advantage of that kind of research. And I do know the limitations of everybody's position and exactly what they work on. Myself, what I'm invested in is solutions, right? And one of the launching pads is for every organization that's involved as far as environmental. You guys have to, in order to have a sufficient emergency contingency plan, that means that all parties involved in one aspect of another need to be engaging each other to come up with a feasible plan constructively that cover all aspects, and even the parts that you are not responsible for. They need to be at the table, and you guys need to be talking amongst each other to come up with a sufficient emergency plan when it comes to each community, you know?
Yeah.
And that means that you're also bringing in the conversations about the projected sea level rise in different aspects. Talking about Proposition 65, what chemicals are in the earth, what chemicals are actually freeborn? What are you finding that's trending consistently across the in that community from person to person that's physical, you know? Because for me, I'm on a mission. I do not want to leave another generation of toxicity behind me. Does that make sense?
Oh yeah, yeah, absolutely. And I think I want to clarify too. With what I'm saying here, I'm not saying that this is the way things should be. We do need to work together more, and we need to kind of break down those barriers. Also, we need to talk about changing, authorities and responsibilities. I just want to kind of frame the way things are right now, and then we can talk about the way things should be, so that we can change that, and we can do exactly what you're proposing. So
before we close today,
yeah,
it would be very important that we know collectively how we can support you in that effort of having everybody at the table to actually come up with an emergency contingency plan that makes sense for each community.
Okay. Yeah, let's make sure that we talk about that.
Okay, thank you.
Oh yeah, absolutely. Yeah, of course. Thank you. Thank you for participating. Joe, you got your hand up?
I'm sorry. Yeah, I'm at a conference today, and I can't stay for the full 2 hours.
Okay.
I appreciate that you've invited us all back again, but
Yeah.
I've got to say, and I think that's Marie Harrison that was making a comment.
Ariane.
Her
Yeah.
and Mark Abramowitz, a couple of other people I know that I've seen in the participants list, have joined me in talking about the problems and concerns for a very, very long time. And I got to tell you that when you come out and say that the goal of this process is to fix risk assessment, that's not what you should have taken away from the very first meeting. I had to miss the second one, and I apologize for that. But out of the first meeting, you heard from Mark, you heard from Gene Williams, you heard from me, you heard from others, that it's not that we want to solve what's going on at the table of risk assessment. We want you to get up from that table and go to a new table. And we want you to think about alternatives to risk assessment, not how to tweak it to fix it.
Right.
I spent a long time in that first meeting telling you about all the problems that we've been confronting for decades. I mean, decades. I've been personally trying to get not only, the Air Resources Board and OEHA to some extent, but and the districts and everybody else, and for DTSC and the cleanup sites and all of that, to not try to fix risk assessment, but to take a different approach. For more than 20 years, personally, I've been doing this. I've been doing this business for 32 years almost now. So more than 20 of that's been spent just on this issue. And I feel and I know that there has been a whole generational change of people who I talked to 20 years ago about this. But just for one narrow thing with risk assessment, we have tens of thousands of either chemicals that we know to be toxic or potentially toxic. We have probably 7 to 12 different toxicological endpoints that you could categorize. That creates a matrix. And in that matrix, you have so little knowledge of what the dose response relationship is for those chemicals and those toxicological endpoints. We shouldn't have to go beyond that to say that there's fundamental flaws and we'll never get to the point where we know enough to do risk assessment properly from a scientifically valid standpoint, and one that is truly protective of public health. So maybe it's a tool in the toolbox at best, but we have to admit that's a dysfunctional tool, and that we have to acknowledge the problems, the basic problems with risk assessment. And if we are going to use it, then we're going to have to say what those problems are. You know,
And
I
how long
I'm
can you stick with
asking-
us?
I gotta leave in about 10, 15 minutes.
Okay.
I'm asking for you guys to think about an approach that would look at everything along what I say is the continuum, from the threat of a release of a pollutant and the potential of a release of pollutant to that emission or release of that pollutant. Consider ways to reduce the threat, reduce the emissions, reduce the exposures, reduce the dose, and reduce the risk to the extent that we understand it, and reduce the health impacts. And I think when Ms. Harrison's talking about dose and the biochemical markers that have been found in her body, that's a part of this, right? It needs to be part of the solution. And every one of those needs to be combined in a way that we truly protect our most impacted communities.
Yeah.
Thank you, Matt.
Yeah, you bet. Before you take off, okay, so I'm gonna stop sharing the spread, my slides here, because I want to take advantage of the fact that you're here for the next couple of minutes. Amanda, can we bring up the Padlet real quick? So, Joe, I took the comments that you sent me, that you emailed to me, the bullet points, and put them into Padlet already to kind of begin the conversation. I'll stop sharing. I probably have to do that. Do you have in the time that you have available, can you kind of go through these comments and just give us a little bit more information to make sure that we understand what your comments are referring to, and get that conversation going?
I'm looking at this on my phone.
Oh, okay, it's tiny.
in my old age, and even in my young age, I'd never be able to read it.
Okay, let's start with I'll read them to you. Okay, so you have the ethical problem of using assessment to inflict anonymous harm on innocent people, or as Jeff Goffman said, the acceptance of
John Goffman. Yeah,
Goffman. Premeditated random murder. That's kind of self-explanatory, but I know that's an important one, so I thought I'd bring it up with you.
Yeah, and it's an ethical issue. It's not a scientific issue. But yeah.
Right. Okay. Are you still there?
Yeah.
Okay, sorry. The masking of value judgments as science, implying that risk management decisions are based on science.
Mm-hmm.
Can you kind of give us a little bit more of what you mean there?
So you and OEHA approach risk assessments as science and tell people that there are scientific evidence in terms of dose response relationships. Okay. Sometimes, and we might have a pretty good idea what that dose response relationship is, but in other times we don't. And that becomes readily apparent. So back in the 90s, we realized that the 40 toxic chemicals in diesel exhaust, when you added up the risk from each of those individually, it didn't match with the data that we had from railroad workers being exposed to diesel exhaust. So we actually went back at that time with the help of John Freunds to create a dose response relationship and count diesel exhaust as a toxic air contaminant. The federal government doesn't do that, but we do, and that's good. But that is the exception and not the rule. So in that aspect, we're saying that this is science, but we know that it's not actually good science. So there's a problem with that. The second part is when we shift from this risk assessment to the risk management. So risk management is a policy decision, and that's not science. That's an ethical decision on how many people you're going to knowingly put at risk of cancer, premature death, a variety of other health impacts. And that is not science. That is a social, policy, ethical decision that policymakers, that I've been one, have made in terms of what is going to be acceptable in terms of the risk. And that again is not science, but it gets framed as science, and it gets sold as science. And it's not fair to people to have to struggle with trying to figure out what the hell's wrong with this, because it doesn't feel right. And then once when, I mean, I remember it's been a long time, but once I realized that it wasn't science, it's like, oh, no wonder I was never comfortable with this. And then it becomes more meaningful. But again, that's the issue I was talking about there.
Gotcha. Okay. Thank you. Yeah, I understand. How much more time do you have?
10 minutes.
Okay. How about the comment that you have, the myriad of unscientific assumptions used in risk assessment process and the failure to deal properly with known unknowns and unknown unknowns. So if you could unpack that a little bit for us.
Right. And I get criticized by Professor Amy Kyle for citing to Caspar Weinberger, but he was the one person in recent history who said that there are known knowns and known unknowns and unknown unknowns. So there are things that we know that we don't know, right? So like that matrix I was telling you about, the toxicological endpoints, all the different chemicals, we know that a lot of those boxes are missing the data we need in order to do a complete and accurate risk assessment using the scientific methods that are used to approach risk assessment. So those are known unknowns. There are also unknown unknowns that we can't even fathom, that we don't understand it. And those sometimes get discovered later on, but we have to worry about those too. The problem is that when you go from one end of beginning to consider a risk assessment, to conducting that risk assessment, to publishing that number, you end up with a magic risk number and maybe some parameters around it in terms of a range of risk numbers. But when you go through that process, there are a series, just a never-ending series of assumptions that are made. And sometimes you put in a factor, a protection factor, right? I mean, children versus healthy adults and things like that, adjustment factors to try to accommodate that and adjust for it. That might be an over adjustment or under adjustment. We don't know. It's another assumption. And this is in part, why if you have a group of risk assessors and you give them a problem to assess the risk, you end up with different answers because they all make different assumptions and they treat those assumptions differently. And if you can't have the reliability, the inner, rater reliability of risk assessors, then for a fact that you're not getting the correct answer unless you're just getting lucky.
So to me, this is one of the areas where I think we need to spend we need to have another conversation. We need to come back to this and discuss this in more detail. Because my next question is going to be, okay, so what do you propose that we do to fix that particular issue? And you've got to leave in less than 10 minutes. So we can't have that discussion. So
I think, we've been asking for a long time. I've been asking for a long time to take an approach that focuses on things that are back before you get to risk assessment in that continuum, before you get to health impacts in that continuum. So you look at how can we reduce emissions? Because we're just going to presume that those emissions are going to lead to exposures, and those exposures are going to lead to risk, and that risk is going to lead to health impacts. So how do we focus on reducing emissions? And that is a better question than how do we focus on assessing risk and mitigating risk and minimizing risk. Because if you eliminate the emissions, you're being more protective than if you're making all those assumptions about coming up with risk numbers and what's acceptable risk and all of that. So I think you try to take and use more data instead of less. You use data about the potential for emissions and the potential for exposures. You take data about exposures. You take data about releases and emissions, and you use all of that to try to protect communities and reduce pollution and reduce exposure and reduce adverse health outcomes. Instead of looking solely at risk assessment for a lot of what we do, you throw a broader array and a better informed, perhaps none of them perfect, right? A lot of problems with emission inventories, but you use more information to make more informed and admittedly maybe not perfect decisions, but better decisions.
That's what you're driving at. Okay, because I've got 4 hands up beside, or 3 other hands up beside yours, and I didn't see which order they went up in. So it's Dr. Tomke, Jane, and Lily all have their hands up. So did somebody see which order?
Next up is Jane. I will ask you to unmute.
Okay.
Jane, did you get the request to unmute?
Yes, I just did. Okay, well, I have to say, I haven't talked to Joe in a month, but it's kind of like we had a pre-call. Because right now I'm dealing with Stereogenics in Vernon. And what's happening there is I've been trying to get the South Coast AQMD to go and do ambient air testing around it for 2 years, really. So on Friday, I get a call in the morning from Susan Nakamura and Jason Lowe, head of monitoring, and Wayne Nestry's number 2, that they're issuing NOVs, they're issuing Prop 65 warnings. They got inspectors climbing all over the place, but don't worry, be happy, because it's only the offsite workers that are being exposed at excess levels. Well, when I finally get the test data and look at the ambient levels, no, it's not just offsite workers, because the numbers are sky high. You're exposing people probably within, like, I don't know, 3, 4, 5 square miles to excess emissions of one of the most toxic HAPs. And what this comes down to is a policy decision. It's not about science. It's about a series of policy decisions. And what those policy decisions result in is the exposure of primarily low-income communities of color to excess risks from highly toxic compounds. Now, are there alternatives? Yes. The FDA recently approved a year ago alternatives to the use of ethylene oxide as a sterilant. So when I have a call here at 4:30 with Mr. Nastry and all his people working on this, is there a part of the conversation that will say, hey, not only should you be not allowing the facility to operate with these excess emissions, and not only should you stop using a risk assessment number from 20 years ago that's completely outdated and underestimates risk by factors of thousands. But maybe you want to think about actually doing a rulemaking that says you can't use ethylene oxide anymore because FDA has approved alternative stimulants. And that's not the way our system is set up. It's not set up to have those questions. And this is square in CARB's wheelhouse right now with the hexavalent chromium rule coming up. It's exactly what we're talking about. That is, get rid of the decorative platers, force them into trivalent chromium. Don't use the toxic fume suppressants. Use a much less toxic trivalent chromium, and start the anodizers and hard chrome platers on a path to a phase out. And so what Joe's talking about is I'm giving you these real world examples. There's not space in the conversation in the way in which CARB looks at risk to say, maybe we should do something else here. Because when it really comes down to it, when you have chemicals that are being released in the air that are toxic in the part per trillion range, you can't control them. Every time you roll up a door, every time a window gets opened, every time there's an upset condition, that stuff is rolling out. And I mean, give you a perfect example, the city of Paramount just approved the new biorefinery right across the street from elementary school and high school. Like, you don't think there's going to be toxic chemicals rolling out of that facility into that community and specifically exposing the group of people in our society that we know are most vulnerable? And so risk assessment is seen by us as a scheme. It's a scheme to keep the status quo from changing, because there is no room to have a different conversation. And so that's exactly what Joe is getting at. It's not science. It's a tool that's made to look like science, but it's public policy decisions. Right. And it's used in the state of California to primarily continue the practice of poisoning poor children of color. And we just need to come to grips with that, because that's what's going on.
I want to capture what you're saying there, Jane, and I want to get it on this board. So
I think Joe did a great job.
yeah, but I didn't
He's
capture
got
his either. I want to make sure.
Castle
Yeah, he's
Weinberger.
got good stuff here, but I think you had more there. It's not just, you know, it is what he was saying about, you know, the decision making and the science assumptions about scientific, you know, it being a scientific tool. But there was more to it than that when you were talking about. You're including. I'm sorry, I want to get this right. So it's really it's the public policy decision making part of it that we really need to focus on, in addition to improving the scientific tool, if you want to call it that, the tool itself. Is that a fair way of saying it?
No,
And we need to be able to talk
I
about it.
wouldn't. No, I'd scrap the tool.
Okay.
The tool is flawed from the get-go.
Okay.
Every time we go out and do ambient air monitoring at facilities that we know just from their throughput rates are going to have problematic emissions, what do we find? We find, oh my God, there's too much hexchrome in the air, or oh my God, there's too much dioxin, or oh my God, there's too much this or that. It's the wrong conversation. I mean, you got to go back to, you know, risk assessment. We're using a 20-year-old risk assessment number for ethylene oxide. And we're leaving the communities around Stereogenics exposed to, you know, unbelievable risk. Why? You got to ask yourself, why are you doing that? How come they're not shutting Stereogenics down? How come they're not saying, as a matter of public policy, let's look at alternative sterilants? Where's the alternatives analysis? Where's the opportunity for the public and the regulators to say, wow, maybe we don't have to, you know, chrome the decks of aircraft carriers with hexavalent chromium anymore. Maybe we can do something different. That's not part of your rulemaking. It's not part of risk assessment. It's not part of the public discourse. So you've got to ask yourself why. And the reason why is because risk assessment is a tool that was created to support the status quo, not to change the status quo. And the groups that are on the front lines, the communities that are on the front lines of these exposures, they want the status quo changed.
Yeah. Okay.
That's really the fundamental thing. And I think Joe, you know, did a great job of sort of capturing that. But, you know, CEQA does a better job at saying, wait, you know, is there an alternative way that people can get to work in the morning? Do we have to build a freeway and put 100,000 cars a minute on it? Gee, maybe we can do public transit. Gee, maybe we can do a train. Gee, maybe we can have people work from home, right? It's about the choices that you make as a society. And risk assessment is a tool that is at the very basic, it's at the bottom basic part of the pyramid that supports the continuation of the poisoning of poor people of color. And that's why the EJ movement says risk is a 4-letter word to them, because it is.
Okay.
It's seen as the tool of the oppressor. Why? Because it is.
Okay.
I hope that's clear.
Yeah. Yeah.
All right.
I'm gonna put that in here too.
You're gonna put the tool of oppressor on there? I want to see you do that, Matt.
I'm
That'll
doing
be
it.
a real innovation in the conversation.
If I spell it
right. Yeah.
I hope I spelled it right, because it's not giving me
When
a
you
spell
do a
check.
Prop 65 warning and you do it in English, when most of the people are monolingual Spanish speaking, that's a problem. Okay.
Yeah.
What's the point of doing the notification? If it was in, what's that, Moses, what's that that language that they speak in Star Trek, that weird language that one race speaks that's so like now Trekkies speak it? What is
You
it?
just called me a nerd, Gene. Is that what happened right now? That would be Klingon.
Klingon? Yeah, Klingon.
I'm bowing down to your incredible
I'll back you up there, Moses.
knowledge of movies and science fiction.
It's Klingon.
Okay, Klingon. I knew you'd know it. You might as well put a notice out in Klingon, right? I mean, come on.
So for you, and I want to make sure I've got this. It's both. We've got an outdated tool. We've got an outdated method of actually evaluating risk, but then the results of those evaluations are being used to justify existing conditions and not justify change or require change.
Precisely.
Okay.
Right. In a rational world, right, you wouldn't have decorative platers across the street from an elementary school.
Mhm.
In a rational world, we would have moved beyond that, 30 years ago, right?
Mhm.
So, like, look at Stereogenics. We got 35 facilities that emit ethylene oxide all over South Coast Basin. Many of those facilities are medical facilities. Can they use the alternative sterilants? Absolutely. Of course they can.
Mhm.
The only thing you need to use ethylene oxide for is things that go in the human body, like a heart valve and a hip replacement. You would dramatically reduce the emissions of ethylene oxide in the whole state of California by just embracing, pick one of them, I don't care which one of the new sterilants that FDA has approved. How come that's not the conversation we're having?
Right.
It's not. And it
Yeah.
won't, trust me, it won't be for a very long time.
Okay.
It won't be.
Yeah.
Well, we're getting ready to issue a rule at the federal level to put fence line monitoring around all the sterilizers. And I'm like, okay, well, that's great, but why don't we switch sterilants, How come, it's like the internal combustion engine. It's taken us 30 years, but man, EV sales are taking off. What, half the cars sold in Denmark last month were EV. So it always cracks me up that my son, he's got like, well, I don't know, the iPhone, I don't know what it is, 11 or 12 or whatever. And it's like, he's got an iPhone, fancy iPhone that does all this stuff. And, landlines are really passe, although I still have one. And we changed from using landlines to cell phones in like a half a decade.
Yeah.
Don't know why. You never saw the operators marching in the streets to keep their jobs, right? Bam, you had a technological change like lightning.
Yeah.
How come we can't get that in EJ communities? How come we can't get that kind of technological change? Why are we still using old technologies that we were using from the 1940s, 1950s, 1960s?
Right. Okay. Thanks, Jane. Appreciate it.
Thanks, Matt.
Next in the order, Chelsea, did you keep track of that one?
Yeah, before we move on to
Sure.
Dr. Tompkins, there's a question in the chat that I'll go ahead and read aloud for people who called in.
Okay.
It says, current HRA do not value the economic benefits of all health improvements from all different types of air toxics and impact on premature mortality, diseases of the lung, heart, brain, birth outcomes, cancer, and other diseases. Because of the undervaluing of health benefits, it is not given as high priority as appropriate. What methods is CARB developing to improve these methods?
Okay, can you do me a favor, Chelsea, and paste that into Padlet too?
Yeah, I could do that.
Thank you. So in short, I can address a little bit about that question. So currently there are two basic large categories of health risk assessment we do. We do the traditional one that we've been talking about that we're saying, here in this context is flawed and needs to be changed. And that is, an analysis that looks at toxic emissions, and then potential cancer risks and then potential non-cancer, chronic, and acute risks. There's also a grouping or a type of analysis that we do where we look at the effects of PM 2.5, very fine particulate, and it's cardiovascular and pulmonary effects. That is the extent of the non-cancer type of analysis we do currently. Those include premature hospitalizations, emergency room visits, and premature deaths from heart disease and cardiopulmonary disease. So we do evaluate that. There are other pathways that we are currently exploring evaluating, including cancer. So when I say evaluating, what I mean is actually putting a dollar value on it. So there are, and things like lost school days, lost work days. There are a number of things that we're looking at right now to add to the list of things that we can evaluate and then put a dollar value on to help us understand what the real effect on society is for those. We're just in the process of doing that right now. So that it may be a little while before we get to that point. That's my answer to that so far. I'm sure there are other people on this call that could answer that further. So if anybody else wants to speak up to address that question, I encourage you to do so. Is that it right there? Hey, Amanda, can you give me the ability to move these things around, the ones that I didn't actually create? Is that possible? Because I can't move this one.
Yeah, unfortunately, I don't think I can, but
Okay,
yeah, I can get you.
that's fine.
The
If you can
ability
just
to
kind of
do it
slide it up a
afterwards.
little bit. Yeah, so everybody can see it. Make sure we can see it.
Okay.
So I know that's not a complete answer to the question, but if there's anybody else that wants to step in and talk about that, feel free to speak up. If not, I'm going to move to the next. Okay, so Chelsea, let's go ahead and.
Next is Dr. Tompkins.
Good afternoon. Can you hear me?
We can, yes.
Okay. My name is Dr. Raymond Tompkins. I am the chair of the African American Community Health Equity Council in Bayview Hunters Point. And I just finished a study for the Air District in the hidden hazards of Bayview Hunters Point. And I've been in environmental science since I've been a sophomore. That's going back to 1971. So I've been in this, and I've been in Africa, Asia, but I never forget my home base in Bayview. I've been part of the advisory board for the Southeast Clinic for 29 years, and I'm still a part of it. But I wish Joe and I hope the other speaker is still present and working with us. One of the greatest flaws in risk assessment is that the exclusion in your assessment that your medical model is a 35-year-old white male. That has nothing to do with me. Next month, I'll be 73 as an African-American male. It has nothing to do with my wife or my children or my great-grandchildren. If you look at your data, I'm so angry, pissed off, is that in Contra Costa County, for every one white person that dies, 5 African Americans die in that same period of time. For one white person that dies, 3 Latinos die. And that for every one white, again, 1.2 Asians die. Genetic susceptibility is not calculated. When I was in Atlanta back in '95, talking to the author of the Monte Carlo system for risk assessment, I brought up the issue that, again, even to show you how backwards science is and the inherited racism that is within the system, is that the original breast cancer studies done in America were done on white males who has less than 1% chance of developing breast cancer. That's just to let you know how backwards this is. And we've Miss Williams, who's on the line, Mr. Mason, other physicians that are working with me and toxicologists, we've been talking with Oshie for the last couple of months based on benzene that is predominant. And in Bayview Hunters Point, I have studied and did measurements. Dr. Palmer at the university and myself have done studies for over 20 years. And the benzene level in our community in Bayview Hunters Point is 574% above lifelong cancer risk based on EPA 1 in 100,000. I asked Oshie in the last 2 months, because we have been having monthly meetings trying to deal with a more inclusive methodology of risk assessment. And it's not an easy question to address. But we still haven't got one answer yet on the findings and on the calculations and the math that we submitted in this report. You want a copy of it? Give Veronica Edie at Bay Area Air Quality Management District a copy of the report. It's about 155 pages. It is a community-based study that you work with the community, the university, the regulators to show the possibility of getting to the truth. Because most, as one of the, Ms. Harris, who I've known her parents as well as her, said, you guys don't even know what's in the damn community. Right there in LA, they had a previous study that they had 20% of the sources of hazardous sources in the communities that were studied. The regulatory agencies don't have a clue. The same thing is true for San Francisco and the Hunters Point area. We walked this block by block with our elders who lived there for over 70 years. And one of them that participated just died a month and a half ago from cancer, from very aggressive cancer. We find that the African-American women, when Dr. Tomas Aragon was there in San Francisco with us, that having all the scientific, social, economic variables of health, insurance, education, Black women died 77% higher than their white counterparts. We need the science to be real science. We need you to look at benzene is a chemical that Black people are susceptible to because of genetic variances and diseases. Sickle cell anemia, whether you have the trait or not, whether you have the trait or not, it increases your susceptibility. Asthma, which is highly prevalent in the Black community and is undertreated. Also, G6PD deficiency, where the brain cell doesn't metabolize sugar as quick and therefore the electrical flow is slow. We find 16% of African American males have this trait, 12 to 13% Filipinos, and 8% of the Jewish population. And I hate the phrase that the author used, because Judaism is a religion. If you would say Middle Eastern people or etc., it would be far more Mediterranean people rather than a religion, because Judaism is practiced throughout the world. In Asia, where I've been trying to clean up Agent Orange, in Vietnam, Indonesia, Cambodia, all these triggers that are used in the scientific language, you need to work. We in the scientific community needs to work on it. I wish Oshie would step up to the plate here and answer my memo in terms of calculating the risk for that population in Bayview, Hunters Point, the long-term residents. Oscar James, whose grandparents first moved into this community in 1938 and was permitted to buy a home, and that the second week they burned a cross on their front lawn on Paloux Avenue. It didn't get in the newspapers, but his grandparents stood fast. His grandfather was the first Black heavy equipment operator that moved the barrels from the state Superfund site on Thomas Avenue, and they lined the whole shoreline. And it was never cleaned up. It is still there and present in this community. They lined it all the way around Alice Griffith Public Housing, and all the way in the state park at Candlestick Point is built on top of these toxic barrels. We're asking and demanding that an investigation in cleaning this up. Ms. Harris's mother said they never cleaned it up, and she was 100% correct in her analysis. We need to step up. If you're serious in CARB, you need to step up and have real science, an inclusive process of the different ethnic susceptibilities, rather than a white male, a 35-year-old white male, as being the medical model for dealing with chemical exposure. I am tired. If you want to see an example of this, look at Louisiana during the COVID in the first phase of it. 70% of deaths in the state of Louisiana were by African Americans living in Cancer Alley at one point. We are running around with 200 pounds on our back, and that you expect us to run this marathon and wonder why we're dropping dead. You could see the same problems over there in the East Bay. The chemicals are not. It's just that it takes longer for you to die. Dilution of pollution is not the damn solution. death is death. And we see these disproportionate rates of morbidity and mortality rates throughout the state of California. Then let me get one other thing. If CARB is serious, then you have to go and get on the Air District's case for sending their investigators out here with the correct, proper tools. How dare they send an investigator to the Black community and say, I looked at the air and there's no problem. We're not in the 16th century where you want to measure the white caps and want to calculate how many knots you're moving. They didn't even send out, damn it, I'm sorry, a monitor to measure particulates. They spent this 601-page report that I read on particulates, the greatest danger, but not one damn instrument to measure it. You want to wonder why I went to Carver Elementary School and the babies in the first grade had 55% cases of asthma, and 10 years later I come back because the principal and I grew up together and it's 85%. Then to get around this nonsense, then we start busing the children around from different parts of San Francisco to hide the serious issues that are taking place and what is occurring. And I am chair of the biomonitoring that Dr. Himsa Simchai is on the point of. And I have the privilege of working with these scholars and scientists. We're seeing this. We're seeing the effects, not only from a risk assessment, but you need to see what's in the human body and what's killing them so that you can help set regulations for reduction and prioritization. Right now, using, again, this medical model of a 35-year-old white male is insulting and very racist. It's killing us. And it's not a joke. I've been to every month I've had to go to a funeral and say goodbye to somebody I grew up with who died too damn soon. And it's directly related to pollution and diseases. We don't look at, when you look at your 65, what are the symptoms of early detection? You're only dealing from an epidemiological standpoint, what killed them. How about intervention before they die? How about let's cut down on the damn funerals and the tears that you shed? Right now, my sister-in-law has lost her breast. My sister-in-law on top of the hill, on Hunter's Hill, lost both of her breasts. And then my niece just had a lump big as a golf ball removed from her breast. And I just took my wife this morning to the hospital to do a follow-up on the 2 surgeries that she had for breast cancer. This is not something I'm playing back at UC Berkeley in the lab or I'm playing with rats. These are human beings that I loved and cared about that are dying too damn soon. Whether I'm in the scientific community or not, there's a moral and ethical obligation, and I'm pushing for a higher standard than what is being practiced here today. It has to change if you're serious about environmental justice. I don't need to be a damn phrase. I need action and real action. I need the question that I put to Dr. Faust. What is the cancer risk for the African-American male population in Bayview Hunters Point for the last 20 years that I have measured? And we have gone back and measured and talked to our elders from the 40s, 50s, 60s to the present day as to exposure. And of course, those African Americans, Dr. Gillis, and I'll be quiet at this point, Dr. Deborah Gillis in the 90s, and I reviewed her work, she did an outstanding job, her and her other colleague. Black women in Bayview had the highest breast cancer rate in the world, higher than third world nations. But yet they had the audacity and the scientists and the snobs to say, oh, she should have done a longer study. Well, if you would have given them money to investigate the phenomena that's taking place in Black communities, she would have done an excellent job, as she did with the little pennies, just as what I did with the little pennies that I was given to do the air studies, and then have to beg on my friends at the university to do in-kind services. CARB, if you're serious, then give the damn money so that the true answers can be addressed. It's so damn hard. You don't know how many times I have begged friends, and I've just been lucky to have friends in this scientific community that are men and women of integrity, that gives their time free or risk their risk of suspension because they are not being paid enough when they worked with us out there at the shipyard and in the community. Black scientists, we are, oh, you're educated, give this. Hell, every doctor that I know, MD, is still working at the age of 70 plus because we can't retire because of the economic discrepancies, and that they care. These are issues that CARB has to address, and OSHI, both state, because both the federal EPA and the state use the same grievous flaw of using a 35-year-old white male as a medical risk factor, as the medical model. Until you change that, you are underestimating the impact. Oh, we'll make adjustments on the children. You don't deal with genetic variances and increased susceptibility of diseases and the prevalency of disease in that community. Each community is unique. The valley has a different source of pollution. In LA and the Southern Basin, it has a different, some similarities that we can share, but yet there's unique. In the Bay Area, as Ms. Harris talked about, we have radiation. We have serious radiation problems. We have radioactive fugitive dust leaving the work site. And the air district is running away from it. If you have, I'm asking CARB to put pressure on EPA to sit down with us to discuss how do we measure it. We're seeing the people suffer. I'm seeing the patients as the physicians are examining them. We need you to put your pressure on them. If California can demand a higher quality of gas, and damn if I ain't paying it for it at the pump, but it makes a difference, then put the pressure on EPA to step up, damn it, and help us deal with real measurements of radioactive fugitive dust leaving a work site. What equipment do I measure it with? How do we measure it? And what diseases are associated with it? Does it match up with what we're finding in the field? Not some theoretical aspects, because I don't see people from EPA in the field. It is so frustrating. The inspectors, CARB needs to send standards for any damn air inspector throughout the state. They need to have instruments that can measure particulates. You need to have a fluorescent K X-ray handheld unit for every inspector. And this is something that just no amateur anybody, because it produces low-level radiation. So they could point that at the ground and tell you what the chemical composition, just as the gentleman was talking about Star Trek. It would be like Spark when Captain Kirk says, hey, what is it? Now we have the fluorescent K X-ray unit. It may cost $35,000. I don't know with inflation what it's going to cost now, but it will save lives. You won't be sending workers into hazardous situations that they will lose their lives behind. You won't have this blowing on residents as we have now. if you look on NBC News and what was covered, you'll see that. You'll see me out here with my little $500, $600 particulate. But we need these other instruments, and we need the field investigators to be knowledgeable and have the proper tools. That does not happen to the Black community. And unfortunately, they take advantage of people not having a scientific background and acting like they did something. You come to me with that nonsense, I would have flunked you when I was teaching environmental chemistry and engineering at Berkeley. It is disgraceful. It is a form of modern racism that's killing us. It's a slow homicide. And there's no other way I could put it. I need CARB to show leadership and demand the other air districts step up and come into the 21st century and push for cutting edge technology to be employed by the inspectors. Also, one other thing I must, and I will end this, is that I need to see more African Americans in this field. I'm tired of being the only Black face that has a scientific background that can argue about this. I wish that the inspectors, that you take them from their communities. There's Mr. Mason that could assist and do with the training, because they will have that commitment to seek out the truth and not sell us out for a penny or two, which we do have that problem. We need to see more people whose families are at risk, rather than the indifference that we see every damn day. And it's so hurtful. It's beyond hurtful, because I have to go to the funerals. I give those eulogies and I cry. And I don't want to cry anymore. It hurts. I thank you for listening to me. I'll entertain any questions you wish.
Thank you, Dr. Thompson. I appreciate that. I've been trying to capture your comments in Padlet as we've been talking. I'm going to go ahead and post it right now. And if you would perhaps go through and make sure that I got all of your most important points. I'll open it up to everyone too, if you have questions or comments.
Could you hold on 1 second and give me 30 seconds?
No
I
problem.
just had surgery, so I have to take a break for a second.
No problem.
Thank you.
Absolutely. We'll come back to it. Okay. Chelsea, who was next?
Before we move on, I just want to take a moment to ask if there's any questions or comments from the conference line. A reminder to unmute, it's *6. Okay. Next is Mark.
Hi. Gee, thank you for calling me right after Dr. Thompson spoke. That's just an impossible set of comments to follow. I want to say what Joe said, and just that simple comment. What Joe said, what James said. And Joe's kind of a young whippersnapper. He's only been working on this for 30 years. And I've been working on it a little bit longer, but Joe really laid out well the higher level pieces there. And I want to add a little bit of meat to those bones that Joe put out there. Joe talked about policy or science as policy, or policy as science. And I want to talk about things like when the SRP changed the definition of lifetime risk from 70 years, not necessarily based upon new scientific information. A decision was made, yeah, maybe it was a policy decision that lifetime risk was going to be 70 years. And that was changed to 35. And that 35 was supposedly based upon the fact that that's how long maybe people live in a place, but that's not how the 70 years was set. And so where the risk assessments were set up as a way of comparing relative risk and risk among two different things. And you've kind of eliminated that ability to treat it as a relative risk and have similar assumptions all the way down the line by making that change. I also think that the question of risk gets discussed these days as absolute risk versus what policymakers, epidemiologists, and others were telling us back when, that, well, this tool of risk assessment doesn't really give you an absolute risk number. It gives you a relative risk by which to compare things. And that seems to have been lost over the years. And policy decisions have been made treating that relative risk as absolute risk. And so what kinds of things have come out of it? Well, you've got you've moved toward a foundation. Well, this happened way back when, because I do recall teaching this at UCLA, where we use risk assessment as a foundation for whether or not we're going to control. Rather than even on criteria pollutants, we use technological feasibility as the foundation. And when risk assessment is such a weak thing, a weak foundation upon to build anything, it's bound to fail. And I recall teaching about the difference between proposed rules at the Bay Area district, at the Monterey district versus proposed rules for news sources at South Coast. And that should tell you about how long ago it was, because South Coast did not have a news source requirement yet for air toxics. But at that time, at least, the way of treating it was different. You had South Coast, which was talking about a risk and making a decision on how to control that risk based upon a risk assessment. Whereas Monterey said, we're going to control first and then see what our leftover risk is going to be. And I think that kind of concept made more sense. And that kind of has evolved to discussions that you've heard about, where we first try and have alternatives to things that are toxic. We don't put controls over it to start. We try and eliminate that which is toxic. And then we put controls, and then we look at what the risk is. And once you start getting there, you run into very, very iffy things. So technology should be the foundation there. There's also a need for better transparency. And I had missed a good part of the last session that you had, although I was there for most of it. And prior to this session, I listened to the balance of it. And Matt, you talked about CAPCOA. And I guess earlier today, you talked about CAPCOA also as having a role in here. But that's a problem for those that like some transparency. You have CAPCOA in a role essentially a shadow agency. They have no responsibility to Brown Act. They have no responsibility to the public. It's just an association. And that's somehow inappropriate when making decisions on public policy like that. It's just a way of doing things in a back room. In terms of some more evidence, not that you necessarily need it, of areas where the way that we handle it results in bad situations. I would point to South Coast perception that they've stated publicly with respect to looking at increases in capacity at Cometco as saying that, well, if they're in compliance with district rules, that they have to go ahead and issue a permit. And so here you have somebody that's acted in generally not compliant, and maybe they submit something on paper that might demonstrate something. But for this kind of decision to even be close indicates that there's a problem there. So every solution I think that you think about coming up with needs to be compared to some of these existing situations. And how does this approach, how would this approach deal with this kind of situation? I lastly want to point out an analysis that was done about CARB's air toxics program and the AB 1807 program by a friend of mine who worked on the first ETO analysis, a CARB staff person, good friend of mine, Ralph Proper. And Ralph did a published study several years ago before he retired, which identified problems and issues with the air toxics program. And the form of his analysis was not allowed by management to see its way out of the door of CARB and submitted for publication. But I'm sure you've got some copies lying around there. And I don't recall exactly what was in there. Of course, Ralph would have never told me, obviously, what was going to be in that paper. But he did do an assessment in there of what could be better and what has kind of gone wrong over the years, in spite of the many successes of CARB's toxics program. So I would urge staff to go try and track down a copy of some of the early drafts that he had submitted for approval. And that's all I have to say right now. Thanks.
Mark, could you repeat his name? I'm sorry, I didn't catch it. Mark, sorry.
Sorry. Yeah. Sorry. I muted myself and I needed permission to get back in there. Yeah. Ralph Proper, Propper.
Okay. Sounds good. Thank you.
He was many years in the toxics division.
Okay. I'm going to do the same thing here. I've been trying to capture your comments as you've been speaking. I'm going to go ahead and publish them. If you would take a look through there and see if there's anything I missed or things that you want to add or correct. Okay. Let me bring it up here. Come on. Can you see that there? Just put it here to the, yeah, right there. So just read through that if, while we're talking and make sure I got everything. Okay.
Okay.
Chelsea.
Next is LaDonna Williams.
Donna?
Yes, I guess good late afternoon. LaDonna Williams, all positives possible. I wanted to just touch on the opening statements of CARB, where actually I appreciate the meetings and the information that you guys are putting out. On one end, it feels like, okay, changes are being made. So, I try and acknowledge the good before I go in on y'all on the bad. And the good being is that our communities are starting to see more funding. It's not enough because we're so far behind. And when I'm saying we, I'm speaking of environmental justice, those historically disadvantaged, long-term exposed, overexposed, high-risk population communities, where we are starting to see funding with frontline groups. Although you still got a long way to go. There are some major folks who have been on the front line for a very long time that is still being overlooked in these processes, but you are making yourselves accessible. I appreciate that. And these conversations and the breakdown of who's responsible, or at least from your perspective, who's responsible, whose oversight it is, and what have you. However, when I look at the explanation, it's more of the same for the last 30 years, which is agencies pointing the finger at each other and whose responsibility it is, whether it is, I think Dr. Tompkins calls you guys OSHI, but he's referring to OEHA, Office of Environmental Health Hazard Assessment, folks, along with CARB, California Air Resources Board. And I'm learning to spell them out because many times the community folks are saying, hey, you guys run off these acronyms and we don't know who you're talking about. So having said that, these agencies, including UCARB, points the finger at, it's not our responsibility, it's this one. And this one then says, well, it's not ours, it's that one. Bottom line is, and I thought you guys were finally getting it, because this ain't new things that we've been putting out. We've been saying this for years. Risk assessment model that is currently used by OEHA, CARB, Air Resource, BACMed, the Department of Toxic Substance Control, both state and federal, that risk assessment model does not work. We haven't just recently been saying trash it and find another method to work this out. We've been saying this for years, dating back to at least that I could remember 2003, with many of these same folks who spoke earlier on these panels and advisory committees that have no power to make decisions. We only can engage and recommend only for the end result and reports to be ignored. We have held toxic tours from one end of the US to the other. And I know this because it was in 2005, 2006, I helped organize the Northern California Inn. And we actually started that toxic tour in Oakland and came over across the bridge to Hunters Point in those areas. So for folks who said agencies and folks have never been over really in that community, oh, absolutely they have. And it's been taken straight to Washington, D.C. And I know because I've been arm in arm with groups like First Generations who went to Washington, D.C., spoke and met directly with then Senator Clinton and Boxer together, and damn near got threw out by Secret Service simply because we came to advocate on behalf of environmental justice poor communities, because they didn't like that we were holding them accountable for their lack of protection, them along with the agencies, to protect our health. They would turn around and come to these sites and still allow the injustices and these risk assessment models to exist that is not protecting our community. Risk assessment does not stop harm. or prevent harm before it starts, as the EJ principles say we should be abiding by. What it does is it allows more contamination and more burdens on communities who are already overburdened and overtaxed from these lack of protective standards that are set up in the name of science by these fake models. At what point? I really thought CARB was going to come back and say, hey, you know what? We're working with what we have just for right now, but we are diligently trying to change this broken down model that folks have been saying for years does not work. Really, what's behind this is straight up racism, environmental racism, racial racism. They don't care because they have systemically placed Black folks in these areas. From here to New York to wherever you point to, you look on the south side of town, and that is where the people who are dying, who are forgotten, who are overlooked, are situated. And whether they move from that side of South Town, from one city across the bridge to the other, still on the south of the southeast side, that's still where the pollution is allowed to exist. And I am going to call out some Black folks too, because they ain't so innocent either. When we can go over to Hunters Point and look at a homeless shelter on a toxic dump sitting in the middle of a cement, asphalt plant, whatever it is, and a garbage company, and it's radioactive waste and dust blowing all around. And we got Black leadership in that city, from the mayor to the supervisor to environmental justice led community groups who have okayed Black folks living on a toxic dump. Are we gonna have these real conversations or not? And we have the agencies that are co-signing this. Same thing over in South Vallejo, same thing over in Rodale, same thing over in Richmond. Take it over to Cancer Alley, take it over to Camden, New Jersey. It is the same pattern, and they all use the same thing, risk assessment. So when are we gonna start having these real conversations and say, okay, you know what, for those of you like-minded, whatever color you are, if you are about justice, then I lock arms with you. If you not, then I'm gonna call you out. And that being, if we are going to change, stop faking it. Let's change how we're doing things. Dr. Tompkins pointed to this reference man standard, which is that 170-pound white male that is still in place. We worked with then Senator Obama directly with Representative Waxman to change that standard back in 2007, before Obama became president. They promised to make some changes on it. Did they follow through? Absolutely not. So here we are in 2022, and we're still working with a broke down, non-effective model that is killing folks, and particularly American Black folks at the top of the list. That is genocide by any definition of killing off a certain population of people by using chemical warfare. What is worse than toxic contamination that you're eating, breathing, drinking in daily? And we're surprised that our lifespans are cut shorter, yet we can't have these conversations. We can't talk Black specific unless we add in Asian and Latino and LBGT and women. We can't talk Black specific unless we add in every other population and interest. Let's start with the most vulnerable, most killed off population first, who is discriminated against the most and least supported, and begin to address that wrong first. And then all these other problems and issues will fall into place, where we can then begin to be that real inclusive and all society that we all like to talk about, rather than folks being able to feed off the poor like they've been doing. Poor pays. That's what's been happening here. And our small community-based organizations, through these programs, AB 617 or or risk assessment models where they target funds for, we must go through larger white established or non-Black established organizations, many of them that formed years after us, but because of the powers that be, have handed them enough money to succeed, while they've given our Black small community-based organizations enough money to fail. So while we're changing these scientific models and these health standard models that has nothing to do with science, it has everything to do with racist policies that we all know have been in place for years. We come to these meetings for years to address these issues, and everybody acts surprised when we push back saying, hey, this isn't working. This ain't the first time you've heard it. You've been hearing it for years. At what point are we going to really come to the table with all of the players at the table so that nobody can point the finger at somebody that's not at the table? We all come to the table, find out who it is that makes that decision, starting with the economics first, map it out and see who is bearing the most burden of these toxics that exist in the community and these decisions that have been made to allow them to continue to exist. And we put the most money there first and give folks that money to do the work that they need to do. We don't need CARB or any of these agencies to come in and set up no health studies or protocols for us. You give us the funding and we will find our own experts, because many of us are experts. We've been forced to be experts. We've had to learn the terminologies from toxicology to water to soil to air. So you give us the funding to be able to work in our communities to help solve our problems and then partner with you all. We don't need you to continue to lead us around like slaves. So I absolutely know the procedure. I look forward to the next sessions that come up. But what I want to hear is a different explanation, not coming at us with you're going to tweak a broken model that hasn't worked for disadvantaged dying communities from the beginning. I expect at the next meeting to hear, you know what? We've gotten together with OEHA and DTSC and ATSDR and CDC and whoever else, California and Federal Department of Public Health. You've gotten together, you come to the table, and we're now working on a new model that actually work to reduce and eliminate the pollution that has been allowed to exist in our communities. Thank you.
Thank you, LaDonna. I did the same thing here. I'm trying to capture your comments. So please read through it when I get done here and I post it and edit it if you need to. Thank you. Okay. Chelsea, who is next?
Next we have Moses.
Can you hear me?
Yeah.
Okay, great. Good afternoon, everyone. My name is Moses Huerta. I'm a resident of the City of Paramount. I'm also a former public safety commissioner here in the city. Thank you for allowing me to participate in this meeting and the conversation. To build off a lot we've been saying, and I want to give you a frontline perspective and a real time issue that actually just happened here. And Jane alluded to it. There's a refinery that's being converted here in the city that I live in from oil to biodiesel. It's supposed to be healthier, better. I'm going to share in the comments, if I can. This is from the environmental impact report that was published to the city, and it was shared with the community. If I may, I'll just read through it really quickly, just for everyone can hear it. But it says here, and this is in reference to the environmental justice, as we were speaking, due to the significant and unavoidable impacts in air quality, hazards, and noise, and the location of the high density minority and poverty areas near the refinery and along the pipeline route, the project would disproportionately affect minority and low income populations at levels exceeding the corresponding median for the area in which the project is located. And I believe I shared this before, but I think it's even relevant more down when we get here. And I mentioned this into a real-time situation where what I like to see as we go forward in this conversation, sharing and looking at data. And this report, it's 468 pages, and it has 102 mentions of cancer in there. And it all references HRA, health risk assessments. It goes down, it breaks down, and they summarize this statement in there on how it would impact those risk assessments. Now, to the previous speakers, how did they get those assessments? How are they valued? How are they specific to the community? So in the real time and giving you from this frontline perspective, this decision, the community meetings happen, and engaging with the decision makers here in the city, planning commission and city council. They read this report, but again, in having the correct the information that's really down to the community level, seeing the actual impacts, not only just given this general risk assessment, but saying, this is amount of individuals that are really going to be getting cancer, or so on and so forth, any health issues, to then really spell it out for these decision makers to then from this bottom up and helping really direct the change that we are all looking for in environmental justice. As Jane alluded to, we change it from the top down, getting away from one chemical to the other, or just eliminate it purely. But at the short term, having this information, some real solid information to have in this right here with my neighbors and my local city council to make this decision and saying before they actually, sign off on these permits to give these business licenses. I had a conversation with the one of the planning members here in the city, and he did mention that before they issue a conditional use permit or a business license in the city, they are checking with the local air district if it is a business that is going to be infecting to see what they've put together. Now, if they are checking with that in their checklist, which is I appreciate they're doing that and making that effort to actually put that in their decision. But we should also have this information that's really solid, that actually breaks down to this level, micro, if possible, to really give teeth to their decision making, or really give them pause that are we going to approve this? Because as you can see in the statement, long term, again, this refinery is going to make biofuel for jet planes. There is no airport in the city. There's not going to be used for vehicles as environmental. So, but we in this community are going to be long-term affected by this decision that was made, and not having to really, as a community member, go to them and say, look, here's these specific numbers that, as myself, and I believe, I've shared this with you before. I grew up in this city. I've been exposed to this environment. I have cancer. I've been surviving it. 40 years, I went to school next to that refinery. I used to run track around that refinery. I live within less than 500 feet from 3 forging companies. So, this is at that community where you decide, the community doesn't know and not having this information, but those that do know better and should know and share and actually give concrete, solid information and guiding how they're going to build their communities, and even addressing these companies. For example, this company, this refinery. I agree, in the long term, yes, we should be moving to something better, something less affected or damaging. But as this report that was put together, it references all these health risk assessments. You go through it, all 460 pages, it's all going through that, and you summarize that, but now really giving more detail, or something that I could have went to these meetings and say, look, this is going to hurt us really bad. Let's take a pause and see how we can then make a proper decision and not just give it a rubber stamp. And that's what happened. This refinery is going forward. Within that same week, the assembly member of the state and the county supervisor, they all did a ribbon cutting. Within that same week that was decided by the city council. They came, they touted it as the next big thing in environmental. But here I am stuck with this statement. My community is going to be harmed. It's disproportionately going to be affected long term. And then in the grander scheme of things, other decisions, I have recently, and I've mentioned this to other colleagues, this warehousing issue. We have the diesel particulate matter that's increasingly more in the communities that actually has a heavier risk to the communities. Well, this is increasing in my community. So into our subject in the risk and assessing risk, you have all this that's accumulates together. that really does, in fact, and this is where I, if from my, basic level and understanding, using and understanding this information, trusting you as the experts and these individuals who have been in a long time, I look to you to say, I need to know specifically, is this me? Is this affecting to me specifically, how I grew up, what I'm with, even my demographic, if I may, how can I use this? Can I understand this better? And then just not these risk assessments that went through on this report that just really didn't bat an eyelash to anybody, decision makers, in making this, not only in just with this refinery that just happened, but other businesses here, the forging companies and the chrome platers, as Jane alluded, the hexavalent chromium was a big issue here in the city, still is, and it's one of the most toxic chemicals out there. So, and going forward, in echoing the others that, in going into this conversation, in the capacity of building this assessments, the information, data, to Jane's quote, it's a 4-letter word, but I want it to be the word that I can rely on, the data, this information, this knowledge that I know I can go forward and speak with my neighbors, with my community leaders, and even myself in advocating, going forward, to really have something that I can rely on and help guide us toward, the cleaner air, the cleaner water, the cleaner land, and I think would, help us all, from one end of the state to the other, and so on and so forth. So I just want to add that, and if I need to share that report, I can, where if you want to drill it more deeply. But this was just recently done. This was just within this past month. I hope we, as we continue going this conversation, we can keep that in the forefront. Other than my colleagues with these impassioned statements that I think I agree with everything. Like I said, I'm here as I'm classified as a sensitive receptor. I have this cancer. I'm living with multiple sclerosis. I have been surviving this. What I don't need is something else that's going to make it worse. I'm holding on. I'm good now, but I don't want to I don't want to take that 3-4 steps back. I just want to just stop taking steps back. But thank you for letting me share that in a comment. If I need to share that PowerPoint, Amanda, let me know if I need to put it in the comment. But thank you for letting me share my comment.
Yeah, of course. Thank you, Moses. And please do share that. I'd like to take this opportunity to kind of clarify my opening statement. When I was talking about the fact that we have divided authorities, we have limited authorities, my point wasn't to say, so therefore we can't do anything about it. My point was, this is the reality of our situation, and we need to do something about that. One of the things that we're going to have to do is try to figure out ways to either use the existing authorities that we have and work together, like you were pointing out, LaDonna, having everybody who has the ability to make a decision about their particular area get together at the same table and make decisions together, or find ways of changing that authority. I was really just intending to point out the fact that this is the current situation we find ourselves in. There are legal limits on what we can do that are spelled out in Health and Safety Code. It may be that what we need to do is push for legislation that changes that authority. So I wasn't trying to just brush off our responsibility. I just want to make it clear that we may not be able to come up with all the answers ourselves. We're going to have to work with others. So anyway, I'm sorry, Moses, I'm gonna publish your comments to same thing. Please take a look at it and see if there's anything more you want to add to it. I'm gonna put this under socioeconomic. It's kind of both. I'm kind of running out of vertical space here, so I'm gonna put it over here, but I want to group things together properly. Okay. Chelsea, who is next?
Dr.
Okay.
Tompkins, do you have another question, or did I forget to put your hand down?
No, I had another question.
Okay. I'm sorry, Doctor. I'm sorry, Doctor. It's 5 o'clock. I just want to make you all aware that this session was supposed to go from 3 to 5. I plan on sticking around for as long as you want to talk. But Amanda, are we good with interpreters? staying past 5?
I
Yes.
promise I'll be short.
Okay. You can be as lengthy as you wish. I just wanted to make you aware that we're coming.
No.
Yeah.
Okay.
Yeah.
Could you scroll back up to where you had quoted my comment? Thank you.
Mhm.
Two things. My point, as Ms. Williams was also pointing, is that I want to first prioritize who's the sickest in the community and the population. That's why I gave those numbers at Alameda County. Just she said earlier, they throw us all you people together and prioritizing who's the, when you come into the emergency room, we have to prioritize who do we treat first.
Mhm.
In this case, in the state of California, African Americans, because from the historical standpoint of World War II, when most blacks were recruited from Texas and Louisiana, they put us right next to the industrial complexes that caused this heavy pollution for my parents and the descendants that are still suffering from this day. That is why I put, and our organization put Black people first. Not that we're racist and not that others are suffering, but the most acutely ill patient is the African American population. And that's what we want prioritized first because of the death rates. It's all the numbers, all the evidence is there. Secondly, what wasn't included is that can CARB, and educate me, required the air district standardization of field investigation, that these agents that you send out into the field have air monitors that can measure PM 10 and PM 2.5, which in the literature shows is the most acutely, most dangerous impact on human health. Secondly, that they must be able to take soil samples. The NBC News saw a half an inch of the cement from the grinding up of the cement on window sills. They weren't equipped to take anything. They now have what we call a fluorescent K X-ray that you can point at it and it can tell you the composition and what is in the soil without having to danger yourself. But it puts a low level radiation, so people have to be trained to really handle this. Can CARB do this and standardize investigation procedures? Because just think about it. If you're a physician treating a patient and there's no standardization, what is common practice in Southern California would not be the same in Central or in Northern California. We need a standardized methodology that is employed with the equipment to say you're going to investigate it. It infuriates me to say, I looked at something. You can't see PM 2.5. If the gentleman that told my neighbors that if I was president, I would have had to slap him upside the head. You just, come on. This is not what I taught for since 71 at the college level. This is not what I practiced with the UN when I was in Africa. No, when I was at the foundation in Vietnam trying to clean up Agent Orange in Southeast Asia. We are here, it hurts my heart that here in America, in California, with Silicon Valley, we cannot employ the best technology, which we are capable of saving human lives. I'm asking CARB, make it a mandate and standardization. I'm willing to work with you. Just as Ms. Williams said, I'm willing to sit down and work with you. And how can we improve? It's just that it impacts me so hard. And it's not just a academic lecture that I'm giving. Sometimes my lectures would go for 3 hours, but I'm saying goodbye to people too soon and every damn month. And it hurts. Just as I had to take my wife to the doctors this morning. So it's like, let us work together, but include the technology and that the inspectors are equipped with the tools to make an analysis of an investigation. This is not happening in the Bay Area, and especially in the Black community. in other communities as well. This is what that would be the first step. Equip them with the right tools. Then we can debate whether they use it correctly. And are you doing what I taught you in the classroom? Because so often we see what we teach and what is practice is two different things. And it's like, I've been teaching all these years. I know what should be done. And I'm a novelty that they don't look to see this black face come in here and take you to task on it. Because 99% of the time, I'm the only person of color, only black face in the room. That's why I'm asking, can you make a more conscientious effort that then you bring in other people's experience? Like Brother Moses, please hang in there and keep fighting for your health and stay strong. It's those type of experiences that gives you a broader perspective to help make a difference. And I think with what we have and the tools, we can make a difference if we honestly have an honest discussion and work towards doing something. I thank you for listening to me.
Thank you.
So if you
Sorry.
If you could include the technology aspect and standardization of tools and investigation in the field for field inspectors, and bring some samples back to the lab for that qualitative analysis. Because the field instruments have its limitations. And just as some of the other speakers have spoken, we have to be honest with the public. Science has its limitations. None of us are God. We don't know it all, but we're working for a better understanding of what's taking place. And thanks. Appreciate it very much.
Absolutely. Sorry, I'm just typing really fast here. Okay, I just updated it. Make sure that I capture what you were saying. I think we can standardize field instruments so that we can standardize field instruments so that we can accurately. Yep. Sorry. Okay, hopefully that captured your comment, Doctor. Let me know if it didn't, please. Okay, Lonnie, you've had your hand up for quite a while, so.
Okay, can you hear me?
Yes.
Alrighty. This is Lonnie Mason from First Generation Environmental Health and Economic Development, the Executive Director. I don't want to be redundant. Dr. Tompkins and Ms. Williams covered, quite a bit. I heard some of the comments, earlier, and I just wanted to address the issue in regards to agency not coming into the community. I want to kind of correct Ms. Erin Harris there. First Generation had the opportunity of bringing in Grant Cope, who's now working with the Department of Toxic Substance Control. He was actually the assistant of Senator Barbara Boxer. He was also on that tour that First Generation invited him to. Ariane, I don't think she would, be familiar with that. And because her mother was there too on that tour as well. And so Miss Marie Harrison. And so not only, did I not talk to Barbara Boxer and deal with her and converse, First Generation converse. She worked with us and she allowed, Grant Cope to come to the Baby Hunters Point community Also, First Generation did a tour with the Air District with Jack and Veronica Eady and various members of the Air District. First Generation is also planning to do a tour with CARB. Just recently was on a Zoom call with them a couple of weeks ago, and we talked about them coming on the tour that First Generation will provide them so they can understand and see what's going on within the community. Now, I have another thing. I appreciate you guys taking the time to listen to us and to hear everything that we have to say. And also, what I would like to say is that Mario, is that his name, Mario?
I'm not sure who you're referring to.
The last gentleman who spoke before.
Moses.
Moses, yes, Moses. I feel for you. Take care of yourself. I wish the best. My sister passed away last year with MS, multiple sclerosis, and she was born here in the Bayview Hunters Point community. So, I'm gonna be praying for you because it's serious. It's serious, and that's the reason why we do this, because we have loved ones, as Dr. Tompkins said, a lot of family members and friends who live in this community. But what I want to address to CARB is that you have to do your due diligence when CBOs apply for grants. When they fill out their application, you have to do your due diligence to investigate that organization. We have organizations within the Bayview Hunters Point community, Black-led organization who is responsible for putting a homeless shelter in a toxic dump, surrounded by the cement and the naval shipyard. So how can you be about environmental justice, right, and wanting to do what's right, but yet fund CBOs who are responsible for putting people, especially African Americans, in harm's way? It doesn't make sense. I don't care how they filled out the application. If they're responsible for putting people in harm's way, they should not receive funding because they're not doing the community any good at all. And I've seen it. I looked at the list and I've seen the money that was given out to various CBOs within this community who are directly responsible for putting that shelter there. That's environmental racism. And Director Bauer even said that when we did talk on Zoom with the board of directors, bringing that to his attention. He said that is environmental racism. We know there's an issue. There's an issue here. And you can't allow these things to happen. This is why we went to go visit Clinton and Senator Barbara Boxer during that time, because I was on the RAB with Dr. Tompkins. There were so many things going on here. We was aware of Tetra Tech lying about the soil, but it took someone from inside. They wouldn't listen to us. We made it aware that the soil was still contaminated. But look what they were doing. They were replacing the soil, the dirty soil, the toxic soil, and replacing it with good soil. So we've been involved. We've invited individuals out here. They know what's going on. But my main focus is you cannot allow these individuals who act like they're for environmental justice and get funding and put our people in our community in harm's way. No, sirree. They should not allow to receive funding because they're not speaking up about it. You don't see them on any of these meetings, whether the Air District or DTSC or CARB or Oh, that the other name. Ooh, away. I'm sorry,
Oweha?
I can't.
Oweha, yeah.
Yes.
Yeah.
Explaining and talking about that catastrophe that's going on over there. I guarantee you they won't give us a list of individuals who've already been submitted to hospital from living in that environment right there. The number of people who are sick. No, they're not going to allow us to go in there and get that information. The air district, CARB, everyone, DTSC have to put pressure on the city to do something about that. How can you allow an encampment be in the front of a cement factory who's gone 20 years without a permit, as well as recology enhanced? It doesn't make no sense. And yet you have, I'm gonna say it again, I'm gonna reiterate it again, you have CBOs who are responsible for putting that there, but yet they want to come behind and ask for funding to fight environmental, injustice, when they just committed environmental racism right there. So I just want you guys to keep that in mind. Do your due diligence, do your research. Please do your research when it comes to this individual, when it comes to these individuals. And they're desperate. They're desperate. They need a place to live. They don't know any better. And that's sad. We shouldn't have individuals, succumbing to that because, they're providing a roof over their head and they're providing them food. But yet again, don't take advantage of it because they have a drug problem. What if they decide, or whatever mental health issue they have, and what if they get help or they get assistance and they decide to get off drugs, and then 5 years later, they have some type of disease or cancer from inhaling that stuff for I don't know how long. It was supposed to be temporary. It's 2 years. I think it's been 2 years now since that encampment been there. And nobody is doing anything about it. But yet you fund individuals who are responsible for putting that there. I'm gonna say it again for the third, I know for the fourth time, because it didn't make any sense to me at all. They're not trying to help the community. They're making it difficult just because it was a simple, you put a Band-Aid on a serious wound that needs surgery. That Band-Aid is not going to be able to do anything. It's not going to heal the process. So it should have never took place. Never. They should have never put it over there. But they wanted to get out of it and be something simple. They didn't want to put their thinking caps on because it was simple and it was a large space, and it was money. They wanted the money. That's not right. And I'm sorry, this is people in this is Black people in my own community. This is sad. I know they don't like me. I can care less. I'm all about the people and about what's right. It's not about the money, it's about the people and their health here. That's sad to take advantage of someone all because of money. It doesn't make no sense. And I'm sorry, I didn't want to say this long, but I just had to say what had needed to be said. And it just didn't make any sense to be, funding individuals who are responsible, entirely responsible for putting people in a toxic dump and not caring nothing about them. And they're just as guilty as the agency, just as guilty, no different, because the agency allowed it to happen. I talked to Jack and I said, Jack, you said it's a city. And I'm like, Jack, okay, it's the city, but did you inform them? Did you make them aware that that wouldn't be a good idea? But yet they turn around and do a photo app and provide air filters for that particular encampment shelter. And so it's like almost you're in agreement. But when First Generation brought it to their attention about air filtration, you go right after the tour, after we bring it to your attention about the air filters, then you turn around and give it to the homeless shelter and to the organization, fund them who was responsible for putting them in there. Does that make any sense? That makes no sense at all. None. And when we did the tour, you know, and then CARB couldn't make it. We were going through the pandemic. It was like at the end, we did the tour with the Air District. And not only that, I asked them, did they know anything about it? But they were not honest. I'm not gonna say Veronica Eady, because she was new, she just got hired. But Damian Bream and Jack and all of them, they lied. They said they didn't know anything about it, but they did. CARB was supposed to be on that tour, but they couldn't make it. So we're making it up, and we're going to show them what's going on and what's happening in the community. We're supposed to be getting together sometime soon so we can show them exactly what's going on. And I had my conversation with Ambrian and Natalie. It's also Miss Fletcher as well. So we're looking forward to them coming on so we can, you know, show them and let them see how the people are being exposed here. And you'll see how this wind blows. I mean, it blows strong, very strong. You cannot tell me people are not being affected. But thank you.
Yeah, of course.
Thank you for you know, taking the time out, you know, to listen. And I'm just hoping that they do the right thing, CARB do the right thing, and fund the right people to take care of this situation. You know, because first generation is ready to do the work. And I know they've worked with me, CARB has been working with me, and we've been having conversation about doing what's right over there in that area and making people aware. And so I'm not gonna put you under the bus. They've been talking with first generation and getting something done. And I appreciate that. But we just got to be careful, you know, about funding other organizations that are responsible for putting people in harm's way. That's what made me upset about the whole situation. But thank you. I appreciate you guys taking the time out.
Of course. Yeah, thank you. Thank you for your comment. I think Genevieve had her hand up, but I don't know if she's still here.
Yeah,
okay.
It's up to you, Genevieve, if you want to ask, you know, verbally, but I did see your question in the chat as well.
Hi, yeah, I just threw that in the chat. Just a thank you to everyone who's spoken today, and ask that CARB summarize their next steps for this project.
Okay, well, the next step in this process, I think, is to go through all of the comments and decide how best to address those issues. We need to have, I think we need to have some additional conversations. And as LaDonna pointed out, we're probably going to need to reach out to other agencies and the community groups to figure out who needs to be at the table to start making decisions that are going to have an effect. I don't know what the time frame for that is or how to accomplish that. That seems like the next logical step for this one. It's like Robert just turned his camera on, so I'm assuming you want to say something too. And Rich, if you have any comments on this one, what our next steps are going to be, that would be very helpful too.
Oh, thanks, Matt. No, I appreciate it, and I surely appreciate everything that's been said today, and the concerns and the seriousness of your concerns, and I can tell the passion behind your comments as well. So, there is a lot of things to consider. There's a lot of things to look at, and there's all sorts of challenges that we have too as an agency, and what we can do. But we can certainly go to the table with some of these things that you're talking about, and we certainly can engage with the local air districts, let's say, or with other agencies in their work on cleaning toxics up in communities, and those who are more overburdened and disadvantaged, as with others as well. So those things we can definitely take to the table. You mentioned tours to your communities. Those types of things are very important to us as well. And again, you mentioned those things, Lonnie, too. You brought up the tour you're having in Bayview, Hunters Point, and those types of things that's valuable for us to know too. I mean, we're obviously a large agency, And the more communication we have between different groups and those types of things, that we even know that something like this is going on, is very important for us as well, because our division, our branch, handles a lot of the air toxics. And so those things are very key to us. And for our understanding, this is a good education opportunity for us too, as well, to hear from you. So we thank you for your comments. And like Matt said, we will have future conversations on this, and we will work with you on a lot of these issues and seeing what we can do to the best of our ability. But I think communication and education is very important for us to know right now.
Yeah. I think just looking at what we've got here on the board, this is really the first time that any of us here at CARB have at least attempted to use this type of communication, Padlet in particular, to help capture your comments and try to group them as we can. Ariane, I'm sorry, go ahead. I know you spoke up earlier and we didn't get a chance to put your comments in, so.
Yes, I just wanted to say that this was a very productive meeting. Also, I wanted to also give you guys your kudos for actually having this meeting on this magnitude. It's really important that we address outcomes and that we have solution-based conversations. And sometimes you got to break the machine in order to fix it, right? And identify its weaknesses. Seeing that it's prevalent with weaknesses that presume to exist right now in this current system, I think that the system needs to be revamped. And other than that too, I also want to say that, I got a lot from listening to a lot of the passion that was in the room. And sometimes information is golden. So I like that Mr. Mason addressed the issue with the homeless population that he's speaking of. That is very important and very close to my heart as well. But I also want to iterate that information is golden. When you're trying to address a homeless issue, the best strategy is to go to a homeless coalition board meeting first, and start there by advocating for that population. And also keep in mind that the elephant in the room is that Mother Brown's, the place that he's speaking of, that organization did not put the homeless population there, because I think that information should be rule number one. He needs to know that the person that he needs to address about that would be our mayor and planning and land use. So, I think that those people have been there for too long. I'd seen a need when I went there. When I'd seen that, yes, I had a reaction. So I'm grateful and thankful to the Air District for at least providing air filtration machines for those units, because it was a lot. So I took advantage of a situation where people need their needs addressed immediately, but I didn't have the power or the power to do anything about that decision making when they were placed there. But I do believe that issue is an issue of concern and does need to be addressed. And I'm looking forward to actually giving Lonnie Mason the correct information so he can actually address the people that can actually do something about that current situation. So I thought I'd share that, and my number hasn't changed in years. He's right next to Dr. Raymond Tompkins, which I'm pretty sure was save it with him. And for anybody else that would like to speak to me direct, I'm the most approachable person you can meet in the world. Matter of fact, we've been in the same spaces plenty of times, and that would have been a great time to speak to this or get some clarity on certain things, which I'm always open to that. So I'm going to leave my number in the chat. And please feel free to follow up with me whenever the time permits for you. And thank you very much, CARB, for having this conversation. I really appreciate it. And I look forward to working on some solutions for the community.
Absolutely. Yeah. Ariana, you okay with me putting your phone number in the Padlet?
Absolutely. My number hasn't changed since 2000, since the flip phone. And I'm telling you, for a very long time, I didn't have any boundaries in place. So I still get calls today from several different community members and also their family members. Because if you're able to make a difference in someone's life, that's what they will point to when they need a resource or, you know, some help.
Absolutely. Do you want to just dictate it to me and I can just type it in?
Sure. 415
415
504
504
5107.
5107. Okay. Sounds good. Okay, I updated that. Now it's in there. Okay, so what I want to do, I think, is go through all of this. We're going to organize it a little bit better, make sure that we've got some major headings that we can use to create the next, or to identify the next conversation we need to have. But we're also going to publish this and provide it to you, all of you. I want to make sure that we've captured all of your comments and questions, mostly comments, accurately. So when we send this out, if I'd like to ask all of you to go through it and feel free to add. I'm not saying you can't add anything that we didn't talk about, but make sure that I at least got what you were saying written down accurately and got to the point that you were trying to make. And then if there's additional information you want to add, feel free to do that too. That's great. You know, the more information we have, the better. So that will be the sort of the next step, at least in this process, is going to be to get this to you so that you can make sure that we've got everything down properly and we've addressed all of your comments accurately. After that, that's a good question. We're going to have more conversations about this. We're probably going to have to do some sort of discussion or polling to find out which of the topics you find are most important to you, and then we'll schedule additional conversations based on that. So anyway, any thoughts on that, Amanda?
No, I think we do have the translators through 5:30, but I saw that LaDonna has her hand up, so I wanted to give you an opportunity, LaDonna, but I think after this, we probably need to wrap up.
Okay.
Yes, definitely. I get it. I understand it's been a long day. And since I will be the ending comment, I guess I'll give you guys a pass on that. But I was going to say it was very engaging in the very beginning that it was unlimited time with no mention, we better wrap up or let's move on. When there was Jane and Joe Lou talking, it was unlimited. You got the floor, let it go, let it flow. And I get that you guys did that with most of us. So it does disturb me when I hear sort of an ending that's kind of a message to wrap it up. That bothers me when I don't hear it consistently with others. And I love Amanda. I know she doesn't mean anything personally, but I just want folks to recognize that. I wanted to suggest with the follow-up meetings, because yes, it's many meetings, but this is what environmental justice is. So I get it. But these are necessary conversations. And this isn't the first conversation. So I've heard, comments. Thank you guys for holding a meeting of this magnitude. You've held several meetings, listening sessions, and really trying to get our input. So don't think that's gotten past us. It hasn't. I appreciate it. The more information I get and understand your perspective helps me make informed decisions and to share that with my communities, let me just say that, because it really does take a village with all of us to be concerned about everyone's injustice that is happening. But I did want to add in, there was a comment just made about misinformation and giving information about the right source and what organization is responsible. We've been at the table on those discussions in Hunters Point because many of us still have family over there. Born and raised, my hometown, my roots is San Francisco. We've lived everywhere from Hunters Point to Visitation Valley to Potrero Hill to Sunnydale. Alamany projects. These are all the poor areas where you can map it out, and we've been impacted by toxins. However, when Ms. Harrison made the comment about what organization that Mr. Mason was pointing to, and I don't know if he's still on here or not because I didn't check the thing. However, he was not referring to the organization that she thought he was referring to. There was another organization that came in on an Air District meeting, and they admitted who they were. I won't say their names because I don't see them on here. And if they were, I would then call them out. But they admitted they were responsible, directly responsible, for meeting with the mayor and a medical facility, hospital, and some other leadership within San Francisco that came to the table and made this decision for these Black folks to be put on this toxic dump. So when she speaks about getting accurate information, I think she needs to get the accurate information because it came straight from the horse's mouth and who was at the table and who engaged and made these decisions that put these Black folks in harm's way. We're talking about, for those of you that don't know, we're talking about homeless folks that were in the park. It was in the midst of COVID. They needed to house these folks. And the only place they could find adequate at the time in a state of emergency was right smack in the middle of the Recology, which is the garbage dump, and an asphalt facility and a bone grinding company. One of the worst toxic spots they could have picked in San Francisco. That's what they chose for those Black folks, majority Black folks. But on the other side of town, they were ribbon cutting for non-Black folks, Latino on one end, and there was a mixture of veterans and some other mixture of folks on the other end that put them in safe housing. Yet for the Black folks, they were put in trailers. You cannot tell me that's not the height of environmental injustice. So again, when we talk about facts and understanding the history and knowing who the players are, all you have to do actually, you know, it's a wonderful thing now to have technology and the tap of a few keys. And all you have to do is trace who it was that were at these press conferences, smiling and grinning, handing air filters. Mind you, that all positives possible came up with the air filter system on the inside. And thanks to CARB, that you guys helped us with indoor pollution initially, that others at the Air District said it was not under their watch. But when that tour exposed what had happened, then folks decided, oh, we better go get these indoor air filters and give them out. Fine, better late than never. But unless we know the history and the facts of how things have taken place, maybe we shouldn't speak on it. But again, we got an injustice. We're trying, or identified an injustice. We're trying to minimize the impacts on folks who are in a position that have no money, no position, no power to do anything other than to try and survive. And it is a huge injustice and the epitome of racial discrimination and environmental discrimination and genocide to put helpless, vulnerable people on a toxic dump and then explain away why this was done and why this is acceptable. And everybody is guilty of it that was involved for saying yes and checking off the box that it was okay to place these Black folks in harm's way. So now that we know better, we must do better. And we do task agencies to step it up and say, we've got to find these people safe, sanitary housing like we found for those non-Black folks. And thank you for the extra time to speak. You guys, I know it's been a long, long day. If you guys have been Zooming like we have, it's been an all-day process. So I appreciate the extra time.
Of course. Thank you. Ariane?
So LaDonna, I'm agreeing with you on all aspects of that. What I'm saying to you is that we, like you said, we can do better. Now, I believe that at that meeting, there were some concerned citizens that showed up to also make alternative suggestions of where those people could go. They didn't honor that, you know, so right now they have the hand that they've been dealt, and we need to find other alternatives for them. We're trying to get them in housing as we speak, but some people are not moving along as fast as we projected. There are housing options that are available to those residents, because it was important to me that they get transitioned out of there to a more feasible living space. So that's something that I did advocate for. Me, I only work with what I have. And that's a load full of resources. So usually when I find a resource, I take advantage of that resource for our community resident members. Now, there are things that have been in other communities that have not been offered to our community. And me, when I get knowledge of that, then I bring that resource to our community. But for right now, I think that, you know, everything that you are saying across the board is on target. And I also heard you mention something to the effect of getting the money into the right people's hands, the people that are actually boots on the ground in the community. And it should go to residents of Bayview, Hunters Point, and the other areas in the city that you also mentioned that are also District 10. Because District 10 has been advocating for decades, and it's been going on too long to leave another legacy of toxicity. Me, myself, personally, you know, the realization that I have all of these things in my system is just as important and valid to me that we address these issues as it is to everyone else. And I thank you for your advocacy for the community as well. And I also acknowledge Lonnie and what his father and his parents have done in the community as well. I know that him and my mom, you know what I'm saying, we're also interrelated in some of their epithets in their works, and I acknowledge that. So thank you very much for being on this call, bringing your expertise and your knowledge. Well, I appreciate that. And also I left my number so that when you want to talk about other alternative ways to address some of the community residents and things that'll be solution-based for the community, you can feel free to give me a call and we can talk about it and maybe strategize on how we could do things to address not just the issues in Bayview, Hunters Point, but Sunnydale, Betrayal Hill, and Alice Griffith as well.
Okay. I don't mean to cut things off. We've about 45 minutes past the end of our intended session, and it sounds to me like future sessions we might want to consider making longer. Sorry. Okay. Because we don't have the interpreters any longer, we can't continue to provide the interpretation. So I'm thinking we should probably wrap it up here.
So I'd like to wrap it up too, but I'd still like to reiterate that when it comes to Bayview Hunters Point, that those resources should be going into Bayview Hunters Point and to Bayview Hunters Point EJ groups. If it's like they said that it was outside groups that were actually benefiting from the community's pain, they're absolutely right about that. So I know that verbatim that that has been a long historical issue as well. But if you do not live in the community, then you need to get connected with a community group to do those works.
Very good point.
And I wanted to mention too that if some of you still would like to talk, or we may probably have a separate meeting with you if you want to talk about these a little more frequently and offline. We're going to lose some of the key CARB people here to listen to me. We certainly want to listen to hear what you have to say. But if that's something that we can do on a separate meeting or additional meetings or a separate phone call, then we can do that.
Absolutely. So I'm going to leave the meeting. Like I said, I'm totally open to that myself personally. I left my number for anybody else that wants to talk offline to get more insight about me or whatever the case may be, or how we can work together collaboratively to resolve the same issue that we're all fighting for. Have a good day.
Thank you.
And thank you guys
Sorry.
once again.
Yeah, and this is Rich, and let me just add this one last thought. You know, I know we're saying wrap up, but really it's just kind of wrapping up the current day. But we're going to regroup. I need to regroup with the team. We need to talk about this a little bit and continue the discussion with you. So it really is a continuance of what we've been, you know, talking about. I heard a lot today about how we're approaching risk assessments, and you know, there's been some discussions internally about how we approach control measures in general, which I think kind of tie into that discussion a little bit. So we definitely need to continue the discussion, and there will be more. There will be more. And so we're committed to try to figure out how to do it better. And if that means moving forth with some discussions and proposal of just completely changing the way we're doing things, we want to talk about that. So I just want to be clear on that. But so with that, just kind of give us the moment here, just because, you know, I want to give staff a chance to take a break and let our interpreters, you know, go offline. But maybe for the next session, we'll think about making, you know, having a longer block, just so that there's a little bit more space for discussion. So we'll do a little better planning for that in the future. But
Lonnie has one more. Hopefully, yeah. Lonnie, do you want to say something here?
Yes, real quick. To Ms. Harris, I understand what she was saying, but if she's concerned, she was actually on the meeting when that organization admitted to being responsible for what took place. She was actually on the meeting. And so at that time, you know, people had a chance to speak up about the issue and the problem that existed. There was only a few people speaking up against that, and that was First Generation, Dr. Tompkins, and All Positive Possible. And no one else spoke up against that particular shelter. That's all I wanted to say. She was online, and she witnessed the person saying it. Thank you.
All right. Thank you.
Thank you for allowing me to speak. I appreciate that.
Sure. Hey, Matt.
Okay. Yeah. Okay. So just again, what we'll be doing is taking the comments that we have on Padlet here. We'll put it in a form that people can review and respond to, and we'll get that out to everyone that was participating, that's on the participant list, so that you can be sure that we got your comments correctly. And then if you feel you want to add additional comments, please do. We'll be doing that probably early next week. Anything else you want to wrap up, Amanda? Any housekeeping we need to take care of?
No. Everything will be in the follow-up email.
Okay, sounds good. Thank you all so much for participating. I know this is a very emotional topic, and I know you're all frustrated by the lack of progress. I'm hoping that we're going to be making much better progress in the future. That's certainly our intent. And that's why we want to keep talking with you, keep engaging with you, and work to find solutions. So thank you.